sure you speak up so we can hear you on the video, okay? Alrighty. Go ahead.
No. Mr. Smith, my name is Margaret. I'm a nurse student. Wanted to do a health physical on you this morning. I've read through the doctor's orders and I gathered all the equipment, all what I need to do for my procedure this moment. So are you in pain, Mr. Smith? No. I sanitize my hands, put on my gloves, and then, Mr. Smith, I'm gonna start by doing, checking the vital signs on you. First I check the blood pressure, cough, check the blood pressure. I'm gonna check your blood pressure, Mr. Smith. Blood pressure 120/80. That's normal, good, within a good reasonable range. I'm gonna check your temperature, Mr. Smith. Open your mouth wide. I'm gonna put this under your tongue. Your temperature is 96.7. That's normal. I'm gonna check your pulse. While I do the pulse, I'll be checking the respiratory rate as well. Good. The pulse is 78 per minute, that's good. And respiration is 18 per minute, that's good. And I'm gonna check your pulse oximeter, just to check out how much is your oxygen saturation. 95%, you're good. Generally, I'm looking at Mr. Smith's general appearance. Look at him. I can see he's well groomed, well nourished, and he's not in any distress. And he's just dressed good, appropriately. Has a hospital gown for the dressed good for the situation. Now, Mr. Smith, can you tell me? I'm doing my job, Max. Mr. Smith, can you tell me, in case of a fire, what you're gonna do? Mr. Smith says he just ran away. Good, the judgment is good. Orientation, can you tell me where you are? Yes, in the hospital. Mr. Smith, tell me, what brought you here? Because you're sick. So the patient, Mr. Smith, is well oriented in time, place, and person. Can you tell me who's the president? You can tell me if the President Biden. Okay. Now I'm checking the memory. Mr. Smith, can you tell me what you ate this morning for breakfast? Eggs and sausage, good. Can you tell me which year you are born? 1972, good, perfect. He's well oriented in time. Mr. Smith is well oriented times 3. Time, place, person, and situation. Now I proceed with checking the general appearance. We check the skin. I can see it's warm, no erythema, there's no scars, there's nothing. And general privacy, I can see Mr. Smith, you have a center line and have a track here. That's good for you. And around the center line is well. There's no infiltration. There's no bleeding, no erythema, no drainage. That's good. And the center of the track here is well centered. There's no discharge. There's no erythema, and there's no signs of inflammation or infection. And the skin color is normal. Go down to the skin, nails and birds. I can see the nails are shiny, pinkish, and the capillary refill is less than 2 seconds. Now go, Mr. Smith, I'm gonna assess your cranial nerves. Start with cranial nerve number 1. Can you smell? I'm gonna put this. I have a cotton swab. So I broke this one now. Tell me what you are smelling. Yes, alcohol. Alcohol, good. So Mr. Smith, cranium number 1 is intact or factory. Number 2, I'm gonna take the gaze. I'm gonna check your eyes. Can you do this thing? How many fingers are these? 23. 3. That's good. So I'm gonna shine light in your eyes, Mr. Smith, just to further check your eyes. Pupillary reflex. This one. Okay, the eyes are parallel. The pupils are equal, round, and reacting to light and accommodation. So next, I'm gonna do the cranial nerve number. I'm gonna check the cranial nerve number 4. That's a trochlea, oculomotor, and adjacent. 3.6. Okay, now can you, Mr. Smith? Now can you turn your eyes down sideways? Okay, good. The ocular movements are intact, and I can go and check inside and see the mouth. Can you open your mouth wide for me? And then I can see is okay. Now I can shine light in the mouth and see the oral cavity, and see I can change also the ovular. See that I'm testing the cranial number glossopharyngeal, vagus, and hypoglossal. See the ovular is centrally placed, and the palate is good, and the tongue is just like good, it's not deviated. And as you open the mouth, I can see the mucus in the mouth, the dentition is good, the mucus is moist, and there are no lesions or missed tooth. Now good, I come down, check the neck. I'm going to check your neck. The neck is central. I can see there's no thyroid enlargement. The trachea is central placed, and I can see now the lymph nodes. There are no lymph nodes enlargement. Next, now, Mr. Smith, I'm going to check your respiratory system. First, I'm checking with inspect. Let me inspect. Preserve your privacy. Inspect the chest. See the chest. The skin is intact. There are no bruises, erythema, or anything, and the chest is moving good with respiration. So, I'm gonna palpate your chest. See the front side, and then I'm gonna auscultate your lungs. Check your lungs. Breathe for me. Breathe. That is a good breath. Auscultation. Good. Good. The 5 sides. 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 And then I go to the back, and I can auscultate the back as well. Auscultate. Good. There's 9 points at the back. The lungs are clear. And also I would like to do the tactile perimeters on the back. If you can say, Mr. Smith, I'm gonna do the tactile perimeters. I'll do at the back. And see auscultate the tactile perimeters at the back. So far the lungs are clear. Now I'm gonna check your cardiac. Your heart. I'm going to auscultate on your heart. I can see there are 2 sides. Scratch the aortic on the second intercostal aortic, pulmonary on the right, left, orbs, tricuspid, and then the mitral. Auscultate. Good. I can hear you. Sound S1, S2 audible. There are no murmurs. Now, Mr. Smith, I'm gonna examine your belly. Preserve the privacy. I'm gonna expose only the belly. Okay, I can see now the abdominal examination. The abdomen is not distended. There are no masses. There are no striations. There are no lesions. There are no hernias, and there are no scars. Now, let me auscultate your belly Mr. Smith. I start with right lower quadrant. So if you go to the right upper quadrant, left upper quadrant, and left lower quadrant. Good. The vowel sounds are good, they are not hyper exaggerated, and are just within normal. And then I'm gonna do light palpation. Mr. Smith, tell me if you feel any pain. Any pain? No. Now I'm gonna do deep palpation right here on the ileocecal junction. No pain. Up there, liver, gallbladder. No pain, no hepatomegaly. On the stomach and appendix. I mean the stomach and the pancreas on the right, on the left upper. There is no tenderness, no hepatomegaly, and on the left lower, the junction, rectum, the cecum, there's no mass. I can see there are no masses. There are no swellings or masses. And now let me feel for, I'm going to palpate your belly, Mr. Smith. Start with the right lower quadrant. Or the abdomen is tympanic, so there's no dullness, and there are no masses, and the bowel sounds are normal. So your abdominal system is okay, Mr. Smith. Now after that, I'm going to check on your let me check the ears. I'm going to check your musculoskeletal system. As I check your musculoskeletal system, I see the strength. Raise up your arm for me against my hand. You know, strength is good. Upper arm strength is good. Upper arm strength is good. Raise your limbs. Good. It's good. And then I can see now. Can you move your toes? Okay. Yes. Okay, move your toes. That's fine. The two. And then I'm gonna check the reflexes. Check the reflexes. I can do your hair. You're good. And check the patella reflex. And the reflexes, they are good. The reflexes are good. Now I'm gonna check of the range of motion. I would like you to raise up your shoulders. At the same time, I'm checking the accessory, spine accessory muscle, a spinal accessory nerve. I'm gonna press down, try to shrug your shoulder for me. Strength is good. I'm sorry, Mr. Smith, I'll go back. I need to check your ears. I forgot to check your tympanic membrane. Let me just check your ears. Shine light in your ears and take a look at your ears. They're good. And the tympanic membrane is healthy. Very good. And also, I would like to see your eyes, Mr. Smith. Can you push the lower lips for me so I can see your eyes? Yes, I can see the eyes. Oh, the conjunctiva is white and the conjunctiva is pink and the sclera is white. Good. So now I'm gonna check for the pain, deep pain and light pain. I'm gonna touch you, Mr. Smith. Tell me if you feel any pain. Any pain? Deep or sharp? Deep. Deep or sharp? Feel pain? Deep or sharp? Deep or sharp? Deep or sharp? And then I'm gonna touch you lightly with this cotton swab and see if you feel anything, okay? Tell me if you feel anything. Feel? Feel anything? Feel anything? Okay, so all the deep pain and light pain, they are in touch. So now, Minister Smith completes the abdominal examination. I would
Okay.
like also to feel your costo-phrenic angles if you would like to
Margaret.
sit up.
That's 15 minutes, so we're gonna